We are taking influenza as one of among the priority diseases within the country. We are thinking that the influenza is just a surrogate of many of the zoonotic diseases, and countries, especially in Africa, they need to prepare in terms of really the capacity in terms of detection and the lab capacity too. And we also have the National Influenza Center lab, the NIC lab, which not only does the influenza detection, but it has been used to build also capacity for other epidemic diseases. In 2009, we had an epidemic of cholera. We had also episodes of measles, and we have been using the same capacity which have been built for influenza to address detection of these other epidemics. And that is why we are actually seeing that the capacity which has been built for the NIC, it's actually the capacity which has been built for the overall health system within the country. Before 2007, we didn't really have a capacity to detect influenza, as well as the measles and cholera. So the lab capacity was very minimal, and also the surveillance capacity. With the inclusion of some of the funding within the PIP, we have actually used that funding to now build those pillars. We had cases in 2009 for cholera. We had also cases for Rift Valley fever. And these people who have been built capacity for influenza and other related diseases, they've actually used the same techniques, the same technology, the same NIC capacity to really be able to identify these cases. And we could using the NIC lab as a whole, we could really be able to respond on time and really reduce the morbidity and mortality.